The Max Foundation, since 2001, has been involved in providing access to innovative treatments for CML in low and middle income countries. You know, one of the first things I learned when I started to work in this area is that for all these great medicines that you see coming to the market, most, if not all of them, will never reach half of the people in the world. And for diseases like CML, these patients can safely be treated. So the Max Foundation has been involved in partnering with pharmaceutical companies and bringing these drugs to patients in 80 low and middle income countries. And so in this presentation at SOHO, we have talked about our experience of the past 22 years, providing access to TKIs to 100,000 CML patients, providing them with 600,000 years of life. And so today we can provide access to all the TKIs to patients in the low and middle income countries in collaboration with 500 hematologists. And last year we provided access to treatment to 30,000 CML patients, okay? 30,000 CML patients. Thousands of them have been on treatment for 20 years. 13,000 of them have been on treatment for 10 years. And almost 20,000 of the patients that we are treating today have been on TKIs or imatinib for 5 years. So the question we asked was, which of these patients do not need the treatment? Which of them can go on treatment-free remission? And we wanted to pilot a program to know if it's safe and possible to do treatment-free remission in low and middle income countries. So this presentation shows the experience of 95 patients who went on treatment-free remission since August of 2021. Of these 95 patients, the average time on imatinib had been 15 years. The difference between 50% were men and 50% women. And the average age of these patients today was 50 years old, which correlates very well with the average age of diagnosis of CML around the world, which is 36 years old. 7 of the patients that went on TFR were diagnosed as pediatric patients. 2 of them, they were 10 years old when they were diagnosed. And so today, they were attempting to see if they could get off the treatment and continue to be in remission. So we have a cohort of 67 patients that have been on TFR for 6 months or more. And of those 67 patients, only 15 had to restart treatment. 3 of them because of withdrawal symptoms, and the other 12 because of relapse. So the success rate of TFR on these patients was 78%. And so, you know, if we go back to what I just said, that we have a cohort of 20,000 patients that have been on imatinib for more than 5 years, how many of them really don't need the treatment? This pilot has shown that it is possible and safe to go on treatment-free remission for CML patients in the lowest income economies of the world.